Very helpful, hopefully.
Okay, well, we have to introduce you too.
Oh, yes. All right.
So you'll be the first one.
Well, they didn't know, but that's okay.
But
I'm gonna say I'm here more than I
Rick,
they
if
have
you
to
want
know that
to
you're
live stream,
Got it. Yeah, so,
so Rick's doing the live stream, so keep watching.
Good, and I heard that he's also coming in
Yeah,
November to
I
talk
talked,
with you.
I talked to him already, and he talked to Lynn already, so yeah.
Okay, good. That's okay, as long as we have a little bit of distance, we're good.
Waiting to hear if we're ready in the chambers.
Dan first, then Lorna, then Lee, I'll just make mention of that.
I don't see Mary Jo on the screen. I don't know. Oh, there you are.
he's
Oh,
there.
I'm
Yeah.
here. I'm here. I hope. Yeah.
Okay.
I hope they're not waiting for us. I'm just trying to get a signal.
She's ready.
Do they hear you, Tony?
I've sent me a text also.
Yeah, I think they were waving at you. I think they're ready.
Commissioner Carter, we
Yes.
are ready too.
Thank you. The meeting of the Ramsey County Board of Commissioners is now called to order. Would the clerk please call the roll?
Fretham,
Here.
Matas Castillo,
Here.
McDonough,
Here.
McGuire,
Here.
Ortega,
Aye.
I know you're here. I just can't hear your audio.
Here.
Thank you. Reinhardt
Here.
and Carter.
Here. Thank you very much. Commissioner Reinhardt, would you please lead us in the Pledge of Allegiance while the rest of us go on mute?
Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. I did not put my hand up. I don't know why it went up. And you're on mute, Tony.
Thank you.
Okay. I've
We'll
been
move
having
on
some
with our
technical issues
agenda.
here this morning, so it's kind of throwing me off a little bit. Sorry.
Your hand is down. Thank you. All right. We have the agenda of our October 19th meeting. Before you, is there a motion?
Move approval.
Second. Second.
Thank you, Commissioner McDonough, Commissioner Reinhardt. Are there any comments or questions on our agenda this morning? If not, would the clerk please call the roll for us?
Reinhardt,
Aye.
Fretham,
Aye.
Matas Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
and Carter.
Aye, thank you very much. The agenda has passed and the minutes of our October 12th meeting are before you. A motion and a second is in order.
So Move moved. approval.
Thank you very much. I have a motion from Commissioner Reinhardt, a second from Commissioner Castillo. Are there any questions or comments on our October 12th minutes? Thank you. Will our clerk please call the roll?
Reinhardt,
Aye.
Fretham,
Aye.
Matas Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
and Carter.
Aye, thank you very much. And the minutes of October 12th have passed. Today, first on our agenda, we have ordinance procedures. We will take a motion to get the proposed enterprise and administrative services department ordinance waiving the second reading on our agenda. Is there a motion?
Move approval.
So moved. Second.
Second.
Thank you for the motion, Commissioner McDonough, the second from Commissioner Reinhardt. And are there any comments on this item? We'll ask
Madam
the clerk.
Chair,
Yes.
I just wanted to note that we've had a lot of discussion recently on the parks ordinance, and I want to make sure that people understand that this is not it.
Oh, thank you. Thank you very much. Again, this is waiving the second reading of an item we had the first reading waived of, the proposed enterprise and administrative services department ordinance. Are there additional comments? With the clerk, please call the roll.
Reinhardt,
Aye.
Fretham,
Aye.
Maras Castillo. Oh, I heard that, or I heard your mouth move. Okay. McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
and Carter.
Aye. Thank you very much. We've passed the waiving of the second reading of that ordinance. And now we are going to call to order the proposed enterprise and administrative services department ordinance. We will be now holding the public hearing. The public hearing on the proposed enterprise and administrative services department ordinance is now open. The purpose of the meeting is to allow the public an opportunity to comment on the enterprise and administrative services department ordinance. For those who are here to speak at the public hearing in person or via Zoom, when you are called to speak, please state your name and city of residence before making your comment, and you will have a limit of 3 minutes to give your testimony. I do not have a list of those who have signed up to serve. Checking with the clerk, is that correct?
That is correct, Chair Carter.
All right, thank you very much. I will ask again. Is anyone here who wishes to be heard? Or I will ask once, then 2 times, and then 3 times. Is there anyone here who wishes to be heard? And finally, is there anyone here to speak regarding the proposed enterprise and administrative services department ordinance who wishes to be heard? I declare the public hearing is now closed. Thank you very much. We've had the public hearing on the administrative services department ordinance, and now we'll move to item number 5, which is amendments to the Ramsey County administrative ordinance. The motion is to waive the first reading. A motion and second is in order.
Move approval.
Second.
Thank you for the motion and second. Are there any questions on the motion? Any questions or comments? Thank you. I'll ask the clerk to call the roll.
Reinhardt,
Aye.
Fretham,
Aye.
Maras Castillo,
Aye.
McDonough,
Aye.
McGuire, McGuire,
Aye.
thank you, Ortega,
Aye.
and Carter.
Aye. Thank you very much. And so the motion to waive the first reading on the administrative ordinance is passed. We'll now move to setting the public hearing date for the amendments to the Ramsey County administrative ordinance. A motion and second is in order, please.
So move, Madam Chair.
Second.
Thank you for the motion, Commissioner McGuire, the second, Commissioner Ortega. Are there any questions or comments on this motion to set the public hearing date? Thank you. Will the clerk please call the roll?
Reinhardt,
Aye.
Fretham,
Aye.
Matas Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
and Carter.
Aye. Thank you very much. The motion to set the public hearing date for amendments to the Ramsey County Administrative Ordinance has passed. And we will move on. I'm delighted to call on Commissioner McGuire for a special proclamation in honor of Disability Employment Awareness Month. Commissioner McGuire.
Thank you, Madam Chair. It is my honor on behalf of the board to present this proclamation. And I understand that Lynn Kincaid, FAS employee and volunteer guardian, will accept the proclamation on behalf of the entire group, and then we'll make introductions to the staff and providers that will be able to join as time allows. Also, I know that Social Services Director Ann Berry is also in the chambers, and so if they wanted to come forward to accept this, I will present this proclamation. But first of all, I just want to let people know that October commemorates National Disability Employment Awareness Month and celebrates the many and varied contributions of people with disabilities to America's workplaces and economy. It reflects the importance of ensuring that people with disabilities have full access to employment and community involvement. And we're so proud of our community that works in this area. So with that, Madam Chair, I am going to read the proclamation. Whereas workplaces that welcome the talents of all people, including people with disabilities, are a critical part of our efforts to build an inclusive and vibrant community with a strong economy. And whereas Ramsey County calls upon employers, both public and private, to be aware of and utilize the employment skills of our disabled community members by recognizing their worth as individuals and their productive capacities. And whereas in this spirit, Ramsey County is recognizing Disability Employment Awareness Month to raise awareness about disability employment issues and celebrate the many and varied contributions of people with disabilities. And whereas activities during this month will reinforce the value and talent people with disabilities add to our workplaces and communities and affirm the county's commitment to being an inclusive community. And whereas Ramsey County looks forward to continued expansion of employment opportunities for the greater acceptance of disabled persons in the competitive labor market. Now, therefore, be it proclaimed, the Ramsey County Board of Commissioners designates October 2021 as Disability Employment Awareness Month in Ramsey County. Thank you.
Thank you very much, Commissioner McGuire.
Thank you, Madam Chair. I would just like to now introduce Lynn, who is a health and wellness service team financial worker in FAS and a proud volunteer guardian for 31 plus years to supported employee Lorna White. Lynn just recently helped form the new employee resource group named SEAM, which stands for Supported Employees Efforts Manifest Equity. I love that title. The group's goal is to bring employees with disabilities together to support one another and work on issues that bring awareness to all Ramsey County employees with or without disabilities. Welcome, Lynn. We appreciate you being here, and we're looking forward to you introducing the rest of the group that's there in the chambers with you. Thank you so much.
Thank you so much. On behalf of the CME ERG Ramsey County employees, I would like to thank the commissioners, Ramsey County coworkers, and community members for creating this proclamation. There is a quote from the book, The Little Prince, which reads, "It is only with the heart that one can see rightly. What is essential is invisible to the eye." We all need support. We all need to be regarded. We all need to be treated fairly. With honor, let me introduce the founding members of the Ramsey County ERG group that teaches everyone how to see with their heart. Our sponsor, Ann Berry, is the Director of Social Services.
Okay, yeah.
It took me 9 months to find her, and we are just ecstatic that she's with us. This is Lorna White,
Hey,
and Lee Geppert is at the 160 building. He didn't get dropped off here, but you'll get to meet him someday. Trent, you want to come up here? Kekadakis. He told me to just say Trent K, because I would probably screw up his last name. You want to say something, Trent?
Thank you very much for everything. Ortega, I saw you a couple years back. I think he remembers me.
We are absolutely delighted to have you here with us today and to recognize the varied abilities of so many in our community and the contributions that are made. We're honored to recognize this month as Disability Awareness Month, and we are also tremendously thankful for the organization of an employee resource group that brings to light the various contributions and the wonderful talents and opportunities that we have to share with and benefit from people with disabilities in our community who give so much to all of us. So thank you so much for being here. I don't want to shortcut anything that needs to be said from the podium. I do want to recognize also commissioners who may have their hands up, but let me just go back to the podium in case there is any additional comment to be made there. I know others are there with you.
Yes, I'd like to have Kathy Arlington come up, please.
Thank you.
gosh.
Stand right here, Kathy, so they can see you right there. Say hi.
Hi, I'm Kathy Arrington, and I live in St. Paul. What street?
Okay.
Adams Street, whatever.
Thank you.
And I'm planning on moving with my husband someday, Craig. I want to do that, so it might be. I'm going to talk about it on Thursday, because he's got security locks where he lives on a bike, and I got a cat and stuff.
Okay, I got it. That's it. Okay. Okay, great. Paul Fauché.
You want to stand over here?
I'm Paul Fouché. Nice to be here.
Thank you.
Jill Schilling.
Thank you.
Come over this way, Jill.
Thank you.
Can they see you? Yeah, they can see you. Can you see you? Do you want to say something, Jill?
Hi, I'm Jill Schilling, and I thank Vicki for helping us
Yeah.
be getting in to be Ramsey County employees. I really appreciate it.
Great. And then Matt Nelson from Kaposia.
Thank you.
Hello, my name is Matthew Nelson. I work for a company called Kaposia as their employment counselor down at Ramsey County, and it's been an absolute delight to work with these folks. They are the most dedicated employees that the county has. They're some of the first to return to the building when it opened up again after the lockdown, And they all kept busy during the lockdown, working the entire time, and it was just phenomenal to see all their efforts. And thank you for rewarding them.
Let's have a round of applause for everyone's essential efforts.
Commissioner Carter, you are on mute.
Thank you for coming into the chambers with us this morning. We're delighted to have you here with us. I have commissioners who, at least one, who has his hand up, and I will call first then on Commissioner McDonough.
Thanks, Chair Carter. I just wanted to mention, I did have to step away during the reading of the proclamation, and sometimes timing is everything, but I had to help make sure Peggy got on her new track bus to head off to her day work program at one of our contract providers. So
Thank you so much. Thank you.
Thank you so much, Commissioner McDonough. And we knew, of course, that you would be paying close attention, if at all possible. Thanks for joining us again. And also, thank you again to everyone for being here this morning to share with us. We appreciate so much the work that you continue to do for us. It adds so much to all of our lives and is so important to us, both the work that you do here in the community and also the factors that you add to our lives here at Ramsey County, I should say, and also in our families and in our community. So once again, thank you so much. I'll check back for any final comments before we move on.
Thank you, Chair Carter. Just a wonderful way to start the morning this morning, and congrats to the team. Again, one of the hardest working teams here in Ramsey County, and thank you to Lynn for being here today and helping to lead through this proclamation this morning. Congratulations.
Thank you. Thanks very much.
Congratulations all. And I'm sorry, I do see a hand up from Commissioner Matis Castillo. Is your hand up?
I was looking for my heart emoji, but it's no longer on the screen. But just
Thank you, guys.
Say thank you very much and thank you for coming.
Right. We lost our emojis this morning because of our format, but hand claps and thank yous and our heart goes out to you all. We will move on then beyond our proclamation, delightful proclamation this morning, to our COVID update, and standing in the county boardroom for our county managers, our deputy county manager for the health and wellness division. For the health and wellness service team, Kathy Hadeen. Kathy.
Thank you, Chair Carter. Good morning, everyone. This morning we'll have a COVID update. We will also talk about the upcoming vaccination and testing policy, as well as another reminder of the flexible work policy. So I'll hand it over to Director Hawley to get us started.
Thank you, Deputy County Manager Hadeen, Chair Carter, County Commissioners. As of July 27th, as I mentioned in the past, we were at 54 cases per 100,000. Yesterday, October 18th, we are at about 203 cases per 100,000 cases, and these cases continue to rise here in our county. I think we can pull up the vaccine dashboard. Mr. Mike Lindsay, I think, is online.
Mike is going to do it from his screen.
Perfect. Thank you, Director Chang. Thank you, Mr. Lindsay. So I just want to point out the COVID-19 vaccine dashboard that Ramsey County Public Health continues to update. For our zip codes of interest, so if we want to scroll down really quickly, thank you, Mike. For our 55103, we've increased again this week to 72%. Yay for that, up from 71%. And if we look at our zip codes 55106, we're still remaining steady at 73% with no change in that area. And for the 55130 zip code, we're still remaining at 70%, which is great with no change. And again, you know, this past summer and into the fall, we've focused on reaching some specific zip codes and also different communities that we know are at an increased risk of potentially transmitting COVID and are most impacted by the COVID-19 virus. So we'll continue those efforts. Overall, we're seeing about 76% of eligible Ramsey County residents that have received at least one vaccine dose, so that's no change from last week. We'll continue our efforts, of course, to get those vaccines out into the community and making sure they're accessible. For our 16-plus population in Ramsey County, it remains at 72.5% of those eligible having completed a vaccine series, edging up from that 72.4% from last week. And we're remaining steady at about 76.4% of those 16-plus having at least one dose. For our 12-plus population, we're at around 71.7% of county residents, 12-plus, have completed the series. So we're inching up. Last week, we were at about 71.5%. And 75.8% of those 12-plus having received at least one or more doses, so no change from last week. We continue to see small gains in the completed series of metrics as various employers' business vaccine requirement mandates go into effect. So the one or more doses metric has slowed, but the completed series metric continues to edge upward. So that's great news. Mike, I'll now shift to our vaccine summary. Thank you, perfect. We're at around 57,737 doses have been administered at 390 clinics to date. And 61,993 vaccines have been given, including those given by our redistribution partners. 62,454 doses have been received, including those from our redistribution partners through those partnership agreements, so that's wonderful. And during the past week, 154 doses were administered through our 6 COVID-19 vaccine clinic sites and across existing client services. So an update there. For the week of October 17th through the 23rd, St. Paul Ramsey County Public Health expects to administer around 250 doses. Just a few operational updates. We have, of course, our reoccurring community sites for vaccines, the Consulate of Mexico, Arlington Hills, and Oxford. We have a number of pop-up community sites. So the Tubman Shelter is still remaining online, our Harmony Education Center, and the Somali Museum of Minnesota. Coming this week, we have 5 total clinics, as well as providing vaccine to clients in existing programs. I want to mention a few of our other pop-up community sites that have been requested: Best Western Capitol Ridge, Bethesda Shelter, and Lutheran Shelter. Mark Jackson and his team continue to provide vaccine services within our homeless community and folks that are experiencing homelessness. So that's a great effort that St. Paul Ramsey County Public Health will lean into, especially as we go into the winter months. Just want to mention some changing conditions affecting capacity or our demand. We started offering the 3rd dose vaccines, as I mentioned before, on Saturday, October 9th. And as of Saturday, October 16th, we have given around 48 3rd doses or boosters. Dr. Ogawa will talk momentarily around additional booster opportunities. But I'll shift to talk about, public health is definitely preparing, as I mentioned last week, to expand, our sites for, when our 5 to 11-year-olds are able to receive vaccines. So we are prepping for that start date. We'll continue, as I mentioned before, to offer that $50 incentive for our 1st and 2nd doses. And we gave out approximately 125 incentives this past week, so that's good news. And now I want to shift to some statewide announcements. There's a lot happening in the news. So on Friday, Governor Tim Walz announced that he's putting the National Guard on alert to provide staffing support at Minnesota's long-term care facilities. He's also expanding access to the COVID-19 emergency staffing pool, which allows long-term care facilities to request short-term emergency temporary staffing if they're experiencing a staffing shortage due to an outbreak of COVID-19 at their facility. And then he's also directing the Department of Human Services to free up capacity at state long-term care facilities. The activation of the National Guard to help stand up new community rapid testing program sites in both Stillwater, Hutchinson, and Crookston, and at least 3 additional sites that will be announced, I think, very soon. 16 local public health agencies across the state are redeploying rapid tests provided by the Minnesota Department of Health, some of which will be used at community testing clinics, while others will be used for targeted testing efforts. And yesterday, Governor Walz also announced the Kids Deserve a Shot campaign, right? And this is a vaccine incentive program encouraging Minnesotans who are 12 to 17 years old to get fully vaccinated against COVID-19. The program consists of 2 sets of rewards, a $200 Visa gift card for 12 to 17-year-olds who start and complete their vaccine series over the next 6 weeks, and then 5 drawings, so 5 drawings and 5 students within that age group. So there's going to be 5 drawings of 100,000 Minnesota College scholarships for any Minnesotan that falls within that age range, 12 to 17 years old, with a completed vaccine series. Parents and guardians, of course, must enter their 12 to 17-year-olds by that entry deadline to be eligible for the following drawings. And it looks like the Minnesota State Lottery System will be the organization doing those drawings. I want to mention really quickly before I wrap up and turn it over to Dr. Lynn Ogawa that the CDC also released some guidelines for the 2021 holiday season. And I just want to stress that these are really important as we head into the winter months and we're seeing more people go inside. People tend to gather, right? A lot of family and friends and neighbors gathering. And so what do you need to know? And this is per the CDC. So of course, the safest celebrations are virtual with people who you live with or outside, remaining 6 feet apart. If you're vaccinated, continue to wear your mask indoors in areas with high community transmission, which we're still in high community transmission here in Ramsey County and across our state. If unvaccinated, wear masks indoors and get vaccinated, of course, as soon as possible, and delay travel until you're vaccinated. And I think these are things that we stress continuously here, the county board updates, and we'll continue to do so. So those are just a few need-to-knows as we head into our holiday season where people will be gathering. Now I'd like to turn it over to Dr. Lynn Ogawa.
Thank you, Director Holly, Deputy County Manager, Chair Carter, and Commissioners. Director Holly mentioned boosters, and hands went up. So hopefully I'll be able to answer the questions before we actually get to before then. The CDC has met now and has approved Pfizer boosters at a standard dose, and those are the boosters that we're currently providing in our vaccination sites. Last week, they also met and reviewed the data on Moderna as well as Johnson & Johnson. Moderna has made the request, and the CDC is recommending that a Moderna dose at half strength actually be used as a booster dose. The half strength showed a good antibody response and had fewer side effects than a full dose of the Moderna, and so that's the data that they were going off of to seek approval. The final decision has not been completed, though, at this point, and so we are not quite yet providing Moderna boosters, but we will be poised to do so as soon as the final approval is given. Johnson & Johnson is a little bit more still under consideration. It was approved for a booster with the Johnson & Johnson vaccine. However, there is also some other data that will be coming out soon looking at when Johnson & Johnson recipients get a messenger RNA vaccine. There's actually some reasonable data that shows that they may actually have a better immune response when they are boosted with a messenger RNA vaccine. This is an example of how we are really doing real-time research in the middle of a pandemic. And so we're getting bits and pieces of information. We're getting good data, but it takes some time to look at that data and make more permanent decisions. So I expect that we will have the full approval for Moderna going forward soon, and then we'll get more information on how we're going to recommend, or how the CDC will recommend boosting Johnson & Johnson. The other thing that I wanted to touch base about today was monoclonal antibody treatment. The state set up a site, and we are encouraging individuals, especially those who are unvaccinated, if they become positive, if they get COVID, to connect with that site. Monoclonal antibodies, if you receive that infusion within 10 days of having your positive test, reduce your risk of hospitalization by more than 70%, and also reduce risk of death related to COVID. if an individual is unvaccinated, we know that that reduces their risk dramatically. If an individual is vaccinated already, we still believe it confers some additional help in reducing their risk for hospitalization. We don't know how much. We don't believe it's the full 70%, but we do believe that it will still reduce that risk. So for individuals who are positive within the first 10 days of their positive test, connecting with the MDH website, and we can send that link to see if you qualify for monoclonal antibody infusion is very important. So those were a few of the things that I was just going to touch base on. I'll turn it over to Deputy County Manager Hadid now.
Dr. Ogawa, before we turn it back to Deputy County Manager Hadid, I want to check in with a couple of board members who have had their hands up, and appreciate your patience. Commissioner Reinhardt, and then we'll check with Commissioner Mattis Castillo. Commissioner Reinhardt.
Thank you. And I do have to tell you that it seems recently, well, probably for a while now, I start out many of the conversations about COVID with Dr. Ogawa said, and I am so appreciative of Director Holly and Dr. Ogawa and others that are so involved in this day-to-day operation, because we rely on you to be able to get the correct information out to folks. I have to tell you that yesterday, my 8-year-old granddaughter was telling me about this medication to prevent hospitalization. And I told her that I didn't think that that was accurate, but now I find out that she knew more than I did. And my 11-year-old grandson is anxiously awaiting the day that Dr. Ogawa says he can get his vaccine. So when I raised my hand, my question was really about reminding people that are listening about two things. And one is the Docket app and how great that works. And I did realize that in addition to getting my booster, which is going to be, I don't know how often it's updated, but I'm sure will be showing up there soon. But there was another vaccine that I needed that I thought, oh my gosh, I totally forgot about that. So it's a great app, and so I wanted to make sure people looked that up. It's the Minnesota Department of Health, and you can check vaccines for, all vaccines. It's not just about COVID. And then as far as the numbers that Director Holly talked about, clarifying that if those are just those shots administered through Ramsey County, or if it includes the clinics and anyone within Ramsey County that is getting the shot. I think the percentages do, but I'm not sure about the numbers as far as the number of vaccinations that are coming out each week. So I thought that one might be helpful information for folks that are listening as well.
And I believe Director Holly is still in the chambers.
Yes, and I'll turn it over to Laura Anderson. She's right there on the screen. Okay. Chair Carter, thank you.
Thank you.
Chair Carter, Commissioner Reinhardt, thank you for the question. So the numbers that we present are doses delivered by our public health department. So we are responsible for giving, 57,000 of those shots. But the full percentage, of course, that's representative of our general population here in Ramsey County who has received a dose, and we know they're receiving doses at many locations. So
thank you.
Thank you.
Thank you very much for the question, Commissioner Reinhardt, and also for the reminders. I will turn to Commissioner Mattis Castillo, and then I do see Commissioner McGuire will follow. Commissioner Mattis Castillo.
Thank you, Madam Chair. I am really excited about the incentives to get our young people vaccinated. And just two questions, maybe Director Holly, you can answer. Will there be incentives when the vaccine comes out for the 5 to 11-year-olds? Will those apply? And then the question about the 12 to 17-year-old, the new initiative, of course, we'll get asked, what about those who already got vaccinated? Can they register, especially for a college scholarship? That's a really big deal. Is there any retroactive? And then I have one other question after that, so I'll just let you answer those first.
Yes. Chair Carter, Deputy County Manager Hedin, Commissioner Mata Castillo. Yes, so when our 5 to 11-year-olds become eligible for vaccines, we will continue to offer the same vaccine incentive program during that time, or while supplies last. That's what our website says. And so, yes, we plan to continue to do that. We won't offer incentives for the third dose at this time, so that's the distinction. For the governor's initiative, for our 12 to 17-year-olds, I think that it's not retroactive. I didn't see that in the press release, but I could be mistaken. I think if community's listening, if you go online to register for that, I think there'll probably be some, requirements or guidelines there. But that $200, I think, is really focused on increasing, right, the vaccine rates for that population. And so I think folks are eligible for that $200, and then they automatically get placed in that drawing as long as they're within the deadline to submit. So retroactive, that question on retroactivity continues to come up, but I think right now it's just really kind of focused on this time period.
Great, thank you.
Thank you for the question. Go ahead, Commissioner.
Yeah, thank you. I just wanted to make a comment, and I also agree with Commissioner Reinhardt that the Docket app is really fantastic, and I've used it now for my kids. But also just want to caution, as a military veteran, nothing that comes or shots that were given by the VA show up on that docket. So people really need to pay attention. I'm vaccinated. My COVID shot does not show up on docket, nor is my number being listed with the Department of Health. So I just want us to remember that as if you've gotten shots through the federal system, it's not currently translating over. And so if you're a veteran and you're looking for your vaccines, that you should also get those with the VA and make sure you have your documentation appropriately. So just wanted to point that out for our military veterans. And then the last question I have for Dr. Ogawa, and like Commissioner Reinhardt, I often say, what would Dr. Ogawa say or do when I'm asking questions? And so appreciate all of the work that you all do. Is there, thinking about the booster shot, are we going in specific waves? We started with kind of elderly and people in workforce, and where are we at now? Who are we asking to come out and get their booster shots?
Essentially, for all of the data related to boosters, we are most concerned about those who may have waning immunity. And so those who are elderly, over 65, are definitely those that we're most concerned about. Those are also the individuals that, if hospitalized, tend to have more of the complications associated with that. Also individuals who are otherwise compromised, so have other underlying health conditions. And this is why the CDC is a little hesitant to say blanket, everybody needs boosters, is that the data shows that individuals who are younger and healthier tend to have a continued immune response. The question that comes is if it needs a boost, and if an exposure is enough of a boost, or if we actually need a vaccine boost. And that data is still coming back. Primarily, we're recommending, though, that those who are at highest risk sort of line up first again, and that those of us who may be younger and generally healthier plan to get their booster. And in general, they're recommending 6 months after completion of the initial series, but that it's not a rush to get the booster at this time. We're also trying to avoid making people prove their need for the booster and things like that. And the CDC is being being very careful about that as well, and taking people at their word. The other issue is that individuals who are at risk because of workplace or occupational exposure definitely also are recommended to get boosters too.
Great, thank you for that. And one last question on the antibody infusion. If someone is exposed or test positive in the first 10 days, is that a self-referral to those centers, or are clinics, or if someone gets a positive test, are they being referred automatically?
Both, actually. Chair Carter, Commissioner Manis-Castillo, thanks for that question and clarification. So first and foremost, as a family doctor, I always recommend talking to your primary provider and your primary care provider about your own health conditions that may put you at risk when you were tested positive and things like that. But I also recognize that sometimes it's difficult to get in to see your provider or to even talk to them on a virtual visit. And so the state has created a website that individuals can go directly to, answer a few questions, and see if you qualify as an individual who may be at higher risk. And so you can self-refer to the site and receive the antibody infusion. It takes about an hour to do the infusion, and then you have to wait about an hour just for them to monitor for side effects or problems. And so it's about a 2-hour situation.
And do you know, one follow-up and then I'll stop, but do you know, are there fees associated? Is this something covered by healthcare? Is this a free process? How do people get access to it?
Yeah. Thank you for the question. It is free of cost. There is no cost associated with the antibody infusion. It's been shown to reduce hospitalizations, and the idea is that if we keep more people out of the hospital, that frees the hospitals for those who need them, and it keeps individuals at home and safe.
So we're going to hurry up before we get one more last question from Commissioner Manis-Castillo. We have a couple of things before we do go, however, to Commissioner McGuire, whose hand is up still.
Yes, thank you, Madam Chair, and I really appreciate all of Commissioner Manis-Castillo's questions, because then I don't need to ask them. So appreciate that. My question was actually also on the antibody infusion, because I've heard from people who have tested positive and they weren't able to get it. It was really hard to get. So they survived and they're better now without the infusion. But this person happened to be immunocompromised and I felt was a great candidate for it, but couldn't find it. He happened to live in Hennepin County. So I just don't know if you can talk about when you said it, it sounded like there was ready availability, but it didn't feel as though there was. So could you comment a little bit on that?
Chair Carter, Commissioner McGuire, yes, I can't speak to when your constituent, or actually if they lived in Hennepin County, not your constituent, but your friend, had difficulties. But there was, for a period of time, difficulties obtaining it. And that's one of the reasons why MDH set up the centralized spot in the Twin Cities especially. And it just happens to be in our county, which is a bonus for us. And so more accessible for our community.
I appreciate that clarification. Thank you. So people don't have to panic. This person was quite panicked about it. Thank you for that. And one last question, Madam Chair. I also use the docket. I love it. It was great to remind me of my shots I need and had. But thank you, Commissioner Manis-Castillo, for pointing that out. That's something we hope the Veterans Administration gets in contact with docket, because that's unfortunate. And then my last question for Dr. Ogawa is, so remind me, I feel like I've asked this question already, but could you remind us, so now that for people that have been immunized twice and then also have had the booster, do we know yet if this is going to be permanent then, or if we're going to have to get another, is this a permanent vaccine, or will we have to do this again in a year or two?
Chair Carter, Commissioner McGuire, I wish I knew the answer to that, and we don't. We do know that all antibody reactions do decline over time. We still don't know if the decline in antibody is enough to say that people aren't protected, though. And so even if we see the decline in antibody, we may still all be protected. We'll have much better information as we watch and hopefully suppress surges in the future, but that's going to take some time. Yeah.
Thank you. Thank you for all your work, and everyone, the whole team work. Thank you.
Thank you, Commissioner McGuire. Commissioner Reinhardt, you have your hand up.
One last very quick question. So what is your guesstimate about when the 5 to 11-year-olds are going to be able to be immunized?
Chair Carter, Commissioner Reinhardt, we are still very hopeful that it will be early November. And so that's our hopefulness. I will share, we are preparing to be ready for vaccination as soon as we get that approval for individuals who are 5 and older, because we recognize that that is the population that will really help us, again, slow overall spread and protect those who maybe need boosters, right? And those who have not yet been vaccinated as well. So,
Thank you.
Thank you for all of the information. And of course, we have many, many questions. It could take us all day to go through, and we're thankful for the complete information you give us each week. I have one further comment, and that is to request a feedback next week regarding that 12 to 17-year-old incentive that the state is providing. When I heard it, it felt as though the incentive would not be available for the shot, but it seemed as though those who have already received their vaccination could apply for the scholarship. So just wanted to make certain that that was the case, if you know today, or with a follow-up.
Yes, Madam
Thank
Chair.
you.
Madam Chair, Commissioners, Deputy County Manager Hadeen, we'll follow up with more details, and I'll get you kind of just a summary of, there's a lot of information. It's really complicated. Yeah. And for the general public to learn, even just understanding is do I get one dose and get 200? Do I get both doses? Do I have to complete the series? So I'll get more information out to you all later today about that. And I'll also share some information in the MDH fact sheet, which is in multiple language around the antibody treatment. So we'll do that later today. Thank you.
Thank you so much. Once again, I will check back in with Deputy County Manager Hadeen as we wrap up the COVID update.
Yes, thank you, Chair Carter. And I'll try to go quickly. I do have a few additional items to share here today. One of which is the Ramsey County Care Center has seen, unfortunately, 4 residents with COVID infections in the last few days. And more than 13 of their staff have had to have been screened off of work this week due to either their symptoms or to being in close contact with someone who has tested positive for COVID. So the Care Center is on the list to be supported by the National Guard. We're really hoping that that support comes at the end of next week, if not sooner. We know we could use it now. Having the 13 people screened out is actually, clearly stressful and not helpful for the team either. And so we're hopeful to get 10 additional people from the state who provides crisis staffing as needed. You'll also see in the coming board meeting an ask for an approval for an RBA for financial bonuses for nurses who are extremely hard to hire right now because of the shortage of nurses. And unfortunately, we are also feeling the stress of that as well in our long-term care facility. Visitors right now, because of the outbreak of COVID, visitors will be restricted to essential visitors and those who need to be there for end-of-life situations at the care center. Switching over to vaccine testing and flexible workplace policies, as County Manager O'Connor stated last week here at the board, we are getting closer to our November 1st implementation date for our vaccination and testing requirement and flexible workplace policies. Today, actually just probably within the last 15 minutes on RamseyNet, you can now go and find the new vaccination testing policy available to read. We're all seeing it at the same time, so we urge that all managers and supervisors go in and take a look at that policy, get to know it, and ensure that everyone on their teams has the opportunity to also understand the vaccination and testing policy. It's important for everyone, again, to go in and read. The policy does become current or ready to go on November 1st for implementation. Within the next days, employees who have completed their COVID-19 vaccination can upload their results through the self-service function on Summit to provide certification. This will be the way in which employees who do not provide their vaccination certification who will also be able to provide their weekly testing proof each week. There will be training available to all employees on the Learning and Development Center site, and Human Resources will be working to provide sessions to help people fill out the certification and help with any other questions they may have about the policy. Testing requirements are also outlined in the policy. As you know, you can always visit ramseycounty.us and find testing resources within the COVID-19 information as well. The policy also provides information about medical and religious exemptions. HR will be the go-to partner for that information. Thank you to HR. And a huge thank you to the team of staff who have been led by HR, Human Resources, who have been working really hard to ensure that employees have had what they need in the form of information to comply with the vaccination and testing policy. Also, just a reminder about the flexible workplace policy. As you know, we are currently, as County Manager O'Connor described last board meeting, in a remote first work environment where many staff work from home or off-site. As previously stated, the flexible work policy will also go into effect on November 1. There will be 3 phases of bringing employees back on site. We will remain, however, in remote first work environment until the CDC downgrades Ramsey County to moderate or low status for the spread of COVID-19. Due to this, those in this phase, or phase 1, currently working primarily off-site will continue to do so. The phase 1 group, as a reminder, is made up of all full-time employees already working on-site, so those are 24/7 or others who have been on-site because of their job duties, and they've been doing that for the past months. Community embedded or mobile employees, employees working at Ramsey County Courthouse, which includes the county manager's office, the county board office, and other leaders and staff that represent each service team, and the human resources and finance departments, which are located over at Metro Square. Employees in phase 1 should be notified in the next day by managers and supervisors through the workspace alerts that they will be not expected to return to our workspace on November 1, again, because of our COVID spread right now. When the community transmission level for Ramsey County drops from high or substantial to moderate or low, phase 1 employees will receive 2 weeks advance notice to prepare for the return to workspaces per their department plans. Phase 1 department leaders have been and will continue communicating with their teams about specific plans, and we continue finalizing the designation of departments that will make up phases 2 and phase 3, and expect to announce them in November. As previously announced, however, staff located in the East Building or the 160 East Kellogg Building have been designated for phase 3. And this is a lot of information. It will also come out today on Ramsey Net for people to be able to read and take the information in a different way. Each of these phases will take 60 days to fully implement, and that schedule will begin only after phase 1 employees return to their workspaces. So if you do the math and you think about how long we could be at a remote first work environment, it could be closer to April or May before we have all employees working in this new way, and that's guessing based on the trends that we're seeing with COVID-19. So again, a big thank you to the Flexible Workplace Policy team who have worked to incorporate the employee survey into these decisions that have been made. We know these policies come at a time where things are uncertain. We are still in the midst of a pandemic, and we're still trying to figure out what this new reality is for all of us while we continue to serve our Ramsey County community. So thank you this morning, Chair Carter and board. I appreciate the time.
Thank you very, very much. I have a question up from Commissioner Matascastillo.
Thank you, Madam Chair. I'm just curious, as we're moving into our policies and getting our employees to upload documents to prove vaccination status or not, what do we do if someone is not vaccinated and is unwilling to comply?
Thank you. And that is a part of the policy?
Yes.
Deputy?
Chair Carter, Commissioner Matascastillo, I think it's a good question. It is outlined in the policy that we can all go online and read today in Ramsey Net. There are many opportunities and options to take a look at the process in which to follow. We're really encouraging people to, if you are unvaccinated, to ensure that you are testing weekly if you are coming into the office during the remote work time, and then when we move to a full what it means to be in a flexible workplace setting, that you are testing weekly and uploading that information each week. We will work with HR and supervisors if there are challenges to not being able to comply with the policy.
Thank you. I have no further questions. We are still remarkably in a pandemic and in high transmission mode here in Ramsey County. We appreciate the development of our policies, which will enable us to bide through this period. We are hoping that we will soon be in a sustainable recovery mode, certainly having recovered from our pandemic and well on our way. That is our hope. And also from our economic, social, and political unrest that we have seen in this past year and a half. We will take one moment of silence in observation of our current crises and work to move beyond COVID. It's good to have a reminder to just breathe. Thank you. We'll move on then. I'll ask Commissioner Reinhardt to take us through our administrative items.
Thank you, Madam Chair. I move item number 8, which is sole source agreement with CompuLink Management Center, Inc. for Laserfish software subscription. Item number 9 is the joint powers agreement for the Central Certification Program. Item number 10 is appointment to the Workforce Innovation Board of Ramsey County. And finally, number 11 is the August 2021 report of contracts, grant and revenue agreements, emergency purchases, sole source, single source purchases, and final payments. And I so move all.
Thank you for the motion. Is there a second?
Second. Second.
Thank you, Commissioners Reinhardt, Commissioner McGuire for the second. I'll ask for comments or questions on any of these items before we move forward. Are there any? Lacking that, I'll request that the clerk call the roll.
Reinhardt,
Aye.
Radham,
Aye.
Maras Castillo,
Aye.
McDonough, it looks like Commissioner McDonough stepped away. Oh, I'll come back. McGuire,
Aye.
Ortega,
Aye.
Carter,
Aye. Thank you very much. Should we go back to Commissioner McDonough? Has he come back?
he's not back in front of his computer yet.
All right. Thank you. Lacking that,
He's
we
back.
will go ahead. We'll call again.
Commissioner McDonough, we're doing roll call, and you're the last one. McDonough.
Yep, I apologize.
No worries.
Aye, thank you. Yep, I got things going on here, but aye.
Thank you.
Thank you very much. And our entire administrative agenda has passed. Thank you. I'll call again on Deputy County Manager Hadeen for our county connections.
Thank you, Chair Carter. I will let the vaccine and testing as well as the flexible workplace policies updates stand for the county connections today. Thank you.
Thank you very much. I will go on and call on our county commissioners for outside board and committee reports, beginning with Commissioner Fretham. Commissioner Fretham.
No report this week, just a reminder that I'm hosting open office hours on Saturday morning and then the following week during the evening for folks who have questions about the park ordinance in my district.
Thank you very much. Appreciate it. Commissioner Maras Castillo.
No report, Madam Chair.
Thank you, Commissioner. Commissioner McDonough.
Yep, thanks, Madam Chair. One quick update. I know many of you were at the District 10 meeting last Friday. I was on the, every 5 years, MnDOT does a state policy kind of revision to the work help guide for the investments for the next 5 years. I was on it 5 years ago representing AMC, and I'm on it this year also. And the piece I wanted to just really call out is 5 years ago, we really tried to start bringing in the conversation around equity and past harm and recognizing that and elevating that as a part of the decision making in how we make investments in our road and bridge investments and with the dollars we have. And it was really difficult 5 years ago. I'm happy to report that pretty much is dominating the conversation around moving forward with the policy for the next 5 years with full agreement with everybody and recognizing not only the past harm, but recognizing there's a responsibility to help rectify that harm when possible, but ensuring that we do not create any more harm moving forward in these investments. So good news to report on that front. Thank you, Madam Chair.
And thank you very much. Commissioner McGuire.
Thank you, Madam Chair. Just a few things. The St. Paul Children's Collaborative did have a meeting. I know Commissioner Carter, you and I were both there. Just one of the things that we talked about there, and we always have good updates, is that there's a formula change for all of the collaboratives, and they've decided the Children's Collaborative of St. Paul is going to invite the other collaboratives to come in and share what they do and how they do it with the with the St. Paul Collaborative. And I think it's a really good step. I'm going to encourage the Suburban Ramsey Family Collaborative to do the same, and I think the Children's Mental Health Collaborative should do the same about learning how the other collaboratives operate. So I was appreciating that. The Ramsey County had a delegation meeting. Commissioner Metis Castillo and Commissioner Carter and I were able to be on that call. And we had almost 15 legislators that were there. CFO Kutza gave a great update on our American Rescue Plan dollars. And we had great interaction with our delegation. One of the other issues that came up was mental health. Senator Isaacson had a lot of questions about a constituent that he had that needed services. And so we're going to be working in that area. We were grateful that he brought it up. We all know this is an issue that we all care about. And so he wants to help with that. And we said anything we can all do together to encourage more resources for mental health is a good thing. So that we'll be continuing to connect with him. Our legislative team of General O'Rourke and Director O'Rourke and Melissa Finnegan continue to have one-on-one meetings with our legislators in preparation for the upcoming session in January. Actually, I think it starts in February. And we are going to be having another delegation meeting on our platform after we pass our platform in December. So we're continuing our connections with our legislators. Also, I know that most of us were on the District 10 meeting, so I'll just say a few comments that it was great to see almost all of us there because I know we were voting on our priorities, and that's really important that we weigh in on that. And I actually haven't seen the email on what they came up with, but it may be out by now. But it's good for all of us to be weighing in on our Association of Minnesota Counties priorities that we'll be lobbying our state legislature on that. And I know they had a housing conversation too that we were all a part of. And so kudos to everyone who participated in that. I just want to give one upcoming event that is happening, and because a number of us represent Roseville schools, some part of the Roseville schools is that our superintendent is continuing to have our multi-levels of government meeting this Wednesday at 7:30 at the Anpetu Teka Education Center. That's the old Fairview Community Center that they've redone with their last bonding referendum. And we're going to tour that, but also hear what's going on with the Roseville area schools, with all of the work that they're doing. So that's 7:30 on Wednesday morning. So, and that includes, I just have to say, it's such a great meeting. They have city council, school board, county, state legislature. It's just a great coming together of all these levels of government. So every school district should do it. Anyway, thank you, Madam Chair.
Thank you very much, Commissioner McGuire. Commissioner Ortega?
No report, Madam Chair.
Thank you, Commissioner Ortega. And Commissioner Reinhardt?
Thank you, Madam Chair. First of all, I was able to attend what I assume is probably my last meeting of the Local Government Advisory Committee. That is an appointment through the EPA of a little over or a little less, I guess, than 30 elected officials from across the country. The reason I say my last one is because you have a two-term limit. And so I reached that at the end of this year. So, but I have to tell you, I was clearly fully engaged in the work that's being done there. And it is really exciting to see the new appointees that are on that. This is the local governments that have direct input to the director of the EPA. And it was exciting to see under the leadership of President Biden, Vice President Harris, the work that is being done on some really major issues. One of them is, and as soon as I say this, I'm going to say, well, I will tell you right now, I don't remember what it stands for. But they are forever chemicals, and that's the PFAS, PFOA, PFOS. And they had a stakeholder meeting yesterday afternoon, actually, and they're very aggressively trying to move forward. They haven't yet, I mean, there's been a lot of encouragement for them to put them on the list of, you can't use them at all, but they're still working through some of those issues, specifically because it is a chemical that is used for fire suppression fairly often. And so they're trying to figure all of that out, but I can tell you that I think I mentioned at one of our last board meetings that 98% of human beings have PFAS or PFOAs in their blood. And so this is a really serious issue, and really it is great to see an administration that cares about something that is this critical to people on our planet. So, and then I also wanted to point out that, well, two other things. One, Commissioner Fretham and I were both at the Neighborhood Concerned Citizens Group, and that is regarding water gremlin. There continue to be more issues, including 1,4-dioxane that has been found, and having to use bottled water, so they can't drink from their, basically a lot of Gem Lake has, well, it is on wells, and so they have to switch over. There's a lot that's going on here, and I can tell you again, even through the Local Government Advisory Committee, how much of a difference this group made, because it is well known that Minnesota is the only state in the country that banned PCE. And it's, again, such a bad chemical that it's kind of amazing that we are the only ones. But it's noticed, and I think that also helps at the federal level at the EPA in looking at some of these chemicals, the forever chemicals that are out there. Finally, I was at the Clean Water Council meeting yesterday, and one of the things, and I think I've mentioned it here before, is the underground utilities mapping project through the Minnesota Geospatial Advisory Committee, on which I serve, and through Gopher State 1. This is support for a policy statement, and I'm going to be bringing it to the Association of Minnesota Counties. Actually, I've already mentioned it there as well. Basically, what we need for public safety, for public health when it comes to drinking water, fishable, swimmable water, stormwater and its drainage, and then also from a public safety standpoint when it comes to construction projects that are taking place, especially near petroleum lines, and finally, even through, as far as stormwater, the aquatic invasive species. So it's something that really, the underground utilities and the work or the potential of harm to our environment and to people's basic public safety is pretty strong. This legislation is basically trying to make sure that the public and private sector utility providers have a confidential way to report that information. And it's been done in other states, but that is the crux of what we're trying to do here. Because for Homeland Security, for many different reasons, we do not want this information to be out there publicly known. But for those that are digging in the ground, it's incredibly important that we have the location of these. Some of them are abandoned pipelines. So I was very excited that that passed yesterday, and I will be presenting it to AMC as well. Thank you.
Thank you very much, Commissioner Reinhardt. And I'll just report on a few activities from this past week. Together with other commissioners, I was able to attend our AMC district meeting. At the district meeting, we voted on priorities as a district that we are forwarding to the Association of Minnesota Counties, including a number of priorities we're waiting to hear what then the Association of Minnesota Counties will select as chief priorities or key priorities for the upcoming legislative session, with concerns and priorities in the area, I should say, of housing and transportation and bonding, environmental resources, corrections, social services, including mental health, and a number of other priorities being ranked together at a regional level and then at an Association Minnesota Counties level. We also had good discussion regarding county levy setting the maximum levy, and also regarding our American Rescue Program funding and county and other legislative priorities. It was a good meeting. I attended also a meeting of the National Association of Counties as a board member there. I do have to say that it was heartening to see the level of leadership that our county and our state have at the National Association of Counties, looking at our own Commissioner Mary Jo McGuire on the podium as second vice president there, and also noting that Julie Ring, who is our association director in Minnesota, is also the president of her association there at a national level and representing us now there on the board. Had the opportunity to attend a number of other meetings on our behalf this week. I'll skip some of those and just go to the fact that I will be making impromptu calls to each of you as we work toward the implementation of our flexible workplace policy coming up in November to share and to discuss with you the impact on our county board. I sent a note to all of you, and I hope you'll be expecting my call, as certainly we also want to be prepared for November 1st and to understand together its meeting for our offices. That is my report. I will turn to our plans for the balance of the day. We do have upcoming, following this meeting, a county board workshop on communications, advertising, and marketing update. We have estimated it start to be at 10:30. I'm going to want to make certain that we have a good 10-minute break. It does seem like that will work. So we will be adjourning our meeting and going into our county board workshop at 10:30 on communications and marketing. Commissioner Ortega will be leading us through that. And then we have a closed meeting this afternoon at 1:30. It is closed to the public, and there is a special link for board members to discuss a legal matter. With that, thank you for your participation, for all of the information that we've received in this meeting. I see a hand from Commissioner McGuire. I'm going to stop and.
Yeah. Thank you, Madam Chair. I think the agenda actually says 1 p.m. closed meeting on our, but I don't know if it's 1 or 1:30, because on the, just
Yes.
on the legislate, it says 1. So I just want clarification whether it's 1 or 1:30.
I think it's 1 o'clock. I'm sorry if I said
Okay.
30. It is
Okay.
1 o'clock
Okay.
p.m.
Thanks.
Thank you very
Thank you.
much.
Thank you. And
So we have the-
Madam Chair, is the workshop on this same link or do we have a separate link? I don't remember.
No, we do have a link that is posted on our county board site, and it is a separate link for our workshop.
Thank you.
At 10:30. And there is a separate link also for the closed meeting at 1 o'clock.
Thank you.
Thank you. With no further questions then, our meeting is adjourned.
Thank you. See everybody.
Of each sleeping area. Remember to test the carbon monoxide alarms monthly and replace the battery yearly. Replace your alarm before you hear the end of life alarm.